Patient brokering became federally illegal in 2018, yet it still happens constantly. I'm going to tell you exactly why and what it actually looks like when it's targeting your family specific to addiction treatment. I'm Dr. Angela McMahon. I spent over a decade inside of the addiction treatment and mental health industry. I know how this works from the inside. And there is a trial coming up in San Diego starting from last I looked, it was July 6th. And I do plan on going and covering that case to, put it on full public display, I guess. This is a channel where I am trying to integrate all of the different components of compliance and fraud in this addiction space and compile it into one channel. I'm not finding that there's a lot of resources on that, and I find it to be a big problem and a bigger problem than getting recognition for. So, point number one, what patient brokering actually is: paying or receiving money in exchange for referring patients to treatment. So, exactly that. Paying or receiving money in exchange for referring patients to treatment. So, the primary basis for the referral is money based rather than quality based. At least that's how that's interpreted. That's what it's doing. The broker finds the client through phone calls, social media, sober living homes, hospital, emergency rooms, as well as AA meetings or NA meetings or any type of 12-step meeting, which is prohibited. It's supposed to be, but it still happens. So also churches, sometimes they can find them through churches too. I've heard of that happening as well. The program pays the broker, also known as a marketer, by the way, pays the broker per admission, sometimes per day that the client ends up staying. The client never knows the referral was paid. They don't know. And there are cases, I will say, when it's set up differently, where the client is actually in on it. But in many cases, the client has no idea. So this makes it even more difficult for a human being that is already in crisis. The broker's incentive is placement. Heads on beds, they say. Not fit, wrong program, wrong level of care, wrong location, none of those. The foundation is money. It's about money. It's literally about money. So point number two, how it works in practice. Brokers operate as a patient advocate or treatment placement specialists. Sometimes you can also hear them be called business development, again, marketers, patient broker, body broker. I've even heard that called human trafficking for addiction. And however, with that being said, the word marketer has kind of changed because I used to do business development. Business development has kind of changed a little bit. And this was door-to-door organic marketing. That's not what I'm talking about. So they maintain relationships with multiple programs simultaneously. So they're working with several programs, getting paid a lot of money to put a head on a bed based on who is paying them, again, not quality of the program. So programs pay based on the insurance value. So out-of-network PPOs have a tendency to be worth a lot more. I've heard $5,000, $10,000, even $20,000 to be paid for a client with good insurance. Some brokers are in recovery themselves. They can target people that they know. They do social media targeting, Facebook groups for families of people in addiction, hospital discharge units, brokers positioning themselves near to ERs. Sober living homes used as feeder systems. Residents steered towards paying programs. So, number three, EKRA, what the law actually says. So this is Eliminating Kickbacks and Recovery Act from 2018, federal law again. So Eliminating Kickbacks and Recovery Act passed October 2018, federal criminal law, applies nationally because it's federal. They made it illegal to pay or receive anything of value for substance use disorder and mental health treatment referrals. The penalties can be up to 10 years in federal prison per violation. This covers substance use disorder treatment, recovery homes, clinical laboratories. The Ninth Circuit issued a significant EKRA ruling in February of 2026, expanding the scope of the law. Enforcement is accelerating. And again, there's this trial in San Diego that is evidence of that. It's very interesting what's happening over there. More to come. Point number 4. Why is it still happening despite it being illegal? I have so many thoughts on this, but I have a lot of thoughts on my hair getting frizzy too. But anyway, detection is genuinely difficult. Payments disguised as marketing or consulting fees. So the way they create a contract, it's very careful with words, writing it in a way to where they don't have the accountability, because they're just writing it in a way that makes it hard to detect. They're going out of their way to purposely do that, and then trying to justify it by saying these people need treatment, these people, they need our help, we're helping people. You can do that without this also, without paying for them to be in your treatment program. You can do it that way too. Maybe you're not able to fill the beds as quickly. Maybe that's the justification. However, it's illegal. So there's plenty of money to be made in this industry without doing illegal things. Also, patients don't know how to report it. They didn't know that the referral was paid a lot of times, so they don't know what to do. And if they're in on it, they definitely don't want to cause any problems. They want that money. Families usually don't know what happened. Many states have no parallel state enforcement mechanism. Regulatory agencies that are underfunded and not equipped to investigate financial arrangements. So that piece is often missed. I do licensing applications all the time. I know exactly what is required to produce for financials. Not this. The financial incentive is enormous. It's absolutely enormous. A single PPO patient can generate hundreds of thousands in billing. I have another video talking about how the state of Montana recently came out, their commissioner was talking about how he is clawing back money from these people that were coming in their white vans, he said, and coming out to Montana and getting the Native Americans there, bringing them out to California to go into treatment with insurance and billing the insurance, like he said, $9,000 a day. I mean, that's just insane. I typically see $1,000 to $3,000. It can go higher than that. I never knew it could go that high, but apparently it was. And then once the insurance ran out, so much for the idea of we're just helping people. We need to help people, because then these people were getting thrown out onto the streets once the insurance ran out. That's not helping. That's abandonment. So a decade of operating largely unchecked created deeply embedded practices. So point number 5. This is the case that I was talking about. I will say more information on exactly who this is and more details in another video coming up. Again, the trial is supposed to start July 6th. They do have an update. I need to read it, and hopefully it's on a delay. But from what I understand now, it's July 6th down in San Diego. And this person is facing federal EKRA charges, Southern District of California. I attended jury selection, which happened to be in May of 2026. However, there ended up being, I guess, a conflict of interest with the judge that they didn't know about until then. And so after that first day of jury selection, they assigned a new judge, and now the trial is set for July 6th. Which, of course, I was the only person from the public there. And of course, I thought, oh no, what did I do? Why are they rescheduling this? But turns out it had nothing to do with me. I'm just being paranoid. One of the first major EKRA cases to go to trial rather than plea. That's what this is. It's one of the first major EKRA cases. But with that being said, I will say, I have a whole list of issues in this industry that I have a whole list of compiled articles that I am going to be reviewing each one and giving my feedback on them, because this is the place where you can come and find them all in one. I believe that this should have more national coverage. That way families know what's happening, because a low quality program looks the same as a high quality program in many ways. We need to be able to figure this out, because this is an industry that's already stigmatized, and unfortunately people's lives are taken. I've said this in other videos. I lost my cousin in 2023 to a fentanyl overdose. This is extremely important to me. And it's sad. It's really sad. It's also sad for staff members that legitimately want to help people, and they get paid low wages oftentimes. Yet these body brokers are making thousands, hundreds of thousands. I mean, I've even heard that some of them end up becoming millionaires off of this. And it's just, life is unfair, right? It's an example of that. So the trial, it's public record, the testimony, the evidence, the findings. So I will be reviewing everything that's public, including the articles that I found that I'm going to be reviewing. And enforcement is accelerating. So this case, it's going to signal where the industry is heading. And that's why I built this channel. I was kind of thinking the other day, like, is the industry getting better? Like, I'm just not getting the traction I had hoped to get to stand up for the families that are being impacted by this fraud. And turns out, no. I just found another case on June 4th, a different type of fraud, and a couple of cases before that I need to look into more, but plus my 40 some pages of compiled lists of articles. And by the way, it's just links. It's not the actual article. It's just the links, so I can go back and find them with like a little blurb about each one. It ended up being like, I think 41 pages. That's a lot. I think that's worthy of national coverage. And if no one else wants to do it, I'm going to, because I believe in sticking up for the families. I've been a family member myself. I am a family member myself. So basically, patient brokering is illegal. It's been since 2018, and it still happens because the financial incentive is extraordinary. And for years, the risk is getting caught is actually extremely low for years. And also, by the way, the investigation can take years. I've seen it take years in many cases. And that is kind of scary, because the program continues to run, continues to treat people while they're under investigation, because of course you're innocent until proven guilty in all of these cases. They have to prove the case. And many of these cases haven't even gone to court. And then another thing to keep in mind is that once one person gets arrested, they are incentivized to throw someone else under the bus and wear a wire. And that happens a lot too, but that takes additional time. I'm just hoping that in the meantime, while the laws are not changing to become stricter and preventing this from happening, even though I like EKRA, and while these programs are still able to run while the investigation is happening, I just hope people don't get hurt. I just hope. But all that being said, there are a lot of great programs out there. I'm a licensing and accreditation consultant, and I've helped build so many fantastic programs, and I want their voice to be louder too. So years, the risk of getting caught was low, but that is changing. Federal enforcement is escalating. This trial starts on July 6th. It's one of the most significant addiction treatment fraud cases currently active in federal court. And I'll be there. I will be there sitting in the backseat, hoping that I don't cause it to have a new judge. Subscribe and I'll take you inside. Thank you so much for watching. And if you have any ideas of cases that I should cover or reports that you think would be interesting for me to cover, I'd really appreciate it. So thank you. Have a good day.